So my goal here today is to really give you information that will help you decide when your patients might be appropriate for referral for ketamine psychotherapy. And I'm also going to talk about, hopefully I'll be able to inspire you to consider offering ketamine in your practice. It's not that complicated to set up. I think it is a good idea to get some good training, and listening to one lecture on ketamine therapy is probably not enough to get started. But if you guys are interested in training, and it's something that I could put together if there's enough of a group of people interested in that. Treatment-resistant depression is common. 100 million people in the world have treatment-resistant depression. This is a little difficult for me to wrap my mind around how many people are suffering here. We really haven't seen new mechanisms in psychiatry since the SSRIs in the 80s. So one thing that Thomas Insel has said is that psychiatry is the only specialty where the rates of the illness are increasing over time. When you look at cardiology or oncology, you see big changes in terms of how those specialties are controlling the illnesses that they're working with. And depression is really out of control, and we need better tools, in a nutshell. Depression can come from anywhere on that map, right? So diet, exercise deficiencies, dysbiosis, food sensitivities, occult infections, toxic exposures, autoimmune problems, psychological issues like disconnection, spiritual problems, unresolved grief. I think treatment-resistant depression is a really interesting thing for us to work with in integrative psychiatry because it calls on us to use every tool that we have, every place on the map we need to look into. The studies on IV ketamine consistently show a 70% response rate. So this is much higher than what you see in STAR-D for conventional antidepressants. And the other advantage of ketamine is that, like MDMA, you're looking at a handful of exposures for most people. I don't really love the idea of ketamine as a chemical treatment by itself. And I'll say this a number of times here today, is that I think ketamine is a catalyst. It's a tool. Okay, but when it's provided as a standalone treatment, and then the person is now getting maintenance ketamine, it's a little bit like pumping up somebody's tire but not patching the hole, right? You can go down the road for a few days or a few weeks, a few months, and then you're using the tool again. So I think that should be a lesson to us that we're not getting to the bottom of things. We're not addressing what needs to be addressed. What are the underlying causes? As a psychotherapist, I do about half of my practice is psychotherapy. I prescribe quite a bit. I do a lot of integrative work. For me, the most ideal situation for psychotherapy is someone who has fertilizer on their brain and their rumination or their obsessive locked-in thought jail that they're in has a door that's open. So we can actually look at what's going on with them. What are their assumptions about reality? How does reality work? What do they want? Who are they? Ketamine acts like a catalyst. Its chemical impacts are short-lived, but it does open up an opportunity for people who are very stuck, who don't have any motivation to actually begin to execute on the lifestyle changes that we all know are critical for long-lasting well-being to start to happen. Ketamine is not a substitute for the lifestyle changes. So I'm just going to leave you the question, how does ketamine fit into your integrative psychiatry perspective? And I want to encourage you to consider, for people who are really stuck, this can be an amazing opportunity for opening. If you're not interested in providing ketamine yourself, that's fine, but get to know people in your community who might be well-trained and who are doing ketamine therapy in a safe and effective way.